Anesthesia residency can make you stronger or it can completely make you burn out. And trust me, bro, most of the residents repeat the same mistake again and again without knowing. So, let me tell you 5 most common mistakes which even I did in my anesthesia residency and later rectified. You can see some people emerge out as excellent candidates, but others don't. This is because there are certain mistakes which we do in our anesthesia residency and which we can correct but we don't correct most of the times. So let me tell you the most common 5 mistakes which is repeatedly being done by residents during anesthesia residency. Mistake number 1 is I will read later, let me do the work now. Let me learn anesthesia clinically now. Let me read the theory part for the exam. No, this is the number 1 mistake and you should avoid it. Why? See, during my residency, in the first year, I was too much involved clinically and literally I did not have any time after doing 48-hour duties, 24 hours duty. I did not have any time for reading. And I did not know where to start, how to start, when to start. And even if I start to read Miller's, it will be too much exhausting for me, and even after reading one chapter of pharmacology I will feel like I did not nothing went into my mind, and I will close my book and I will think let me learn during the third year. And what did I gain from it? Zero. But what did I lose? I could not clinically correlate what is happening to the patient. I knew that after giving this drug, this is going to happen, and since my senior told this, I have to give this atropine when bradycardia occurs. But I did not know what are the causes of bradycardia and why did the bradycardia occur to this patient, and are there any ways to treat, for example, hypoxia-induced bradycardia? Should I give atropine or should I do something else? These things I came to know once I opened the book and continuously reading it day to day from the second year. You should not do this mistake. You should open your book from the first year and start reading it. Mistake number 2, comparing it with other residents. In most of the places, anesthesia residents will be in a lot because all the hospital, whether it is private or government hospitals or central institutes, they need anesthesia residents to run a hospital because it is a demanding branch to run a hospital. You can run a hospital, a surgical hospital, without medicine residents. You can run a physician run hospital without surgical residents, but you can't run any hospital without anesthesia residents. So it is always in a group, and residents usually tend to compare that he has done 10 intubations, I have done only one. He is able to pass the tube into the trachea. Whenever I put time, it is going into the esophagus. His learning curve in spinal anesthesia is better, mine is poor. He is able to put arterial lines with confidence, I am not. My cannulations are always difficult. This will give you nothing but frustration. See, learning curve is different. During my residency, one of my assistant professors used to tell me that even if you bring some beggar from the road and teach him anesthesia for 3 years, he will know how to deliver anesthesia to a patient safely. But you should learn what is the factors behind it to provide anesthesia. So it's nothing like a rocket science. We will learn eventually. The learning curve differs for each person to another. Maybe you can think like he is putting the tube every time into the trachea, you are putting the tube in esophagus, but you are learning what are the mistakes you are doing, what is the exact position, what is the sniffing position that we have to keep for intubation. Every time, every mistake gives you a lesson. Those things the other students are not getting. You can think it in that way. So never compare you with others. The learning curve is different for every individual. Mistake number 3 is ignoring the basics. This I experienced after starting my DM residency. Like most of the residents, they wanted to know what they see in the TE, what is the new view that they are seeing, what is the thing that they are seeing in the echocardiography, how should we interpret this, how to bring this view. But they forgot the basic anesthesia management, the basic pharmacology of drugs, that they have to monitor the vitals throughout the procedure. If you're doing an echocardiography, simultaneously you have to keep a watch on the hemodynamics and you have to titrate it accordingly. So you should never ignore the basics. The basics such as airway, spinal, pharmacology, hemodynamics. These are all should be in your spinal reflex level as an anesthesia resident or a practicing anesthesiologist. Never ignore your basics. So compared to other residents, anesthesia residents are differing in a way that anesthesia residency is a mental game. Although it is physically exhausting and the duty hours are hectic, it is a mental game. So, if you are not taking adequate naps, if you are not fulfilling your 6 to 8 hours of sleep, if you are skipping meals, if you are not doing exercise, if you are taking too much of caffeine, it will be hazardous not only for you but also for your performance, but also for your patients. So you should take care of your health. You should never ignore your health as an entity. So the fifth thing is reading only before the exams. I will manage the patients, I will chill in the free time, and then I will read just before the exams, omit it in the exam, and then I will forget. No, anesthesia doesn't work like that. Even if you are at your 60s, you should know why this reaction of the drug occurred. What is the dose that has to be given to this drug? Why this thing occurred? Why the change in the hemodynamics occurred during the surgery? What is the critical step of the surgery? So anesthesia doesn't work like that. You should read daily. You should try to read whenever you are finding some time to read. If you read just before the exam, you will forget all the things just after the exam. So try to read day by day, little by little, line by line. Make a small timetable and try to finish it. And then if you are thinking that you are forgetting all the things, then you make notes and revise the notes later so that you can get a grasp of it. So never ignore learning daily and never read only before the exams. Yeah, obviously you should read for the exams, but read daily. So as a final note, I know anesthesia residency is difficult and you don't have time to enjoy for yourself. I'm not asking you to become perfect in just one day. Just push little by little every day so that you can become the perfect anesthesiologist at the end of your residency or during the time of your practice. All the best.